Something that is crossing a lot of people's minds is we are coming off of a COVID-19 pandemic, 2 years of this, and now we're hearing about something else spreading in the country. Is monkeypox a threat to us in terms of another pandemic coming our way, or can we find some relief here?
Well, if considered the general public, the risk of catching monkeypox is low at this point in time. A particular section of the society who are at a higher risk of being exposed to monkeypox virus. But having said that, anybody who is in a prolonged contact with an active case can get monkeypox virus. But generally, we are at a low risk of getting it. It's not like COVID, it does not spread that rapidly. You need to have a prolonged contact, intimate contact at times to get it.
Yeah, so keep in mind, monkeypox is a virus. And I think obviously, coming out of the COVID-19 pandemic, I think people, can be a little fearful when they hear of the term virus and potentially a new virus that is emerging. So keep in mind, monkeypox is not novel, meaning, the virus that caused the disease COVID-19, SARS-CoV-2. That was a novel virus. So, we, meaning the medical community, we've been aware of monkeypox for quite some time. I think, what's something that is important for the community to understand is that we don't typically see this virus here in the United States. So although, we know that this virus has circulated, particularly in parts of West Africa, for example, it's not something that we commonly see here. So, back to the initial question of, is it something that we should be aware of? Is it something that we should keep our eye on? Absolutely.
We've known about monkeypox for decades, but what's different about this outbreak here in the United States?
So monkeypox has been around for a long time. The first human case was seen in 1970s. It's endemic in Western and Central Africa. Most of the previous outbreaks that we had with monkeypox virus were people who went to Africa and were exposed to somebody who was there. But this epidemic or outbreak is seen in people who have not had any contact with Africa, and it's spreading in the community. So that's what makes it different. Secondly, we have not had so many cases in the past. And it seems like that, as I said before, there's a certain particular group of the society, gay, bisexual men, men who have sex with men, that it's spreading more than the general community. Let's put it this way. So, but again, since it's spreading in the community, then it's always a possibility. Anybody who gets in a prolonged contact with an active case can get it. So essentially, what's different is that first, it's spreading in the community like that we have not seen before. Second, it's a little bit atypical at the moment because many people do not have the telltale signs of a monkeypox infection. Usually in a monkeypox infection, you get fever, chills, and then you have swollen lymph glands. Many people are not presenting like this. They are just presenting as a rash, sometimes around their genital areas. And they do not have any symptoms prior to that.
The type of strain, if you will, that's here, is of the more mild type. So again, I don't want to dismiss the idea that there's a new virus that's circulating here. But I just want to make sure that I think everyone has a general understanding that, this is not something that, the infectious diseases community is concerned about from a new lethal virus, if you will. We are aware that case counts are increasing here in the United States. There's definitely an outbreak here. I think that's a proper term, and to feel free to go ahead and call it an outbreak. We in the medical community are making sure that we're educating all of our staff, and that includes those on the front line from when a patient may enter a healthcare setting, whether that's in a clinic setting or in a hospital setting. And we're educating them on these are the signs and the symptoms that we should be aware of now that we have this new virus circulating. The CDC and the WHO, they're keeping their eyes on this situation closely. They're making sure that they're documenting all new cases, and that we have information available online through these reputable sites that help you keep track of where potentially this new virus is circulating. Thankfully, we have not had any deaths related to monkeypox when we're thinking of this current outbreak in 2022 that we're currently evaluating.
And of course, we want to avoid getting monkeypox. What prevention methods would you recommend?
I think the prevention is basically generally what we do for good hygiene. You know, if we've been exposed to or if somebody has active monkeypox infection, then we need to isolate them, and people who live with them should not get in close contact with them. If they are if somebody else is handling their sheets, their clothes, then they at least should not do it with their bare hands, should wear gloves, and hand hygiene is very important afterwards. For people or who are in that specific strata of the society or part of the society who are at a higher risk of getting it or getting exposed to it, should be very careful in choosing their partners, or if should be very cognizant of any new rashes with that their partners are having. Just they need to be aware of it, and essentially, the more awareness that we have, we'll be able to control this outbreak, because the earlier we find cases, the less exposure we will cause to the general community. And I think also healthcare workers need to be aware of it, that if somebody presents with an unusual rash and has had all the risk factors for getting monkeypox infection, then they need to be aware of it. The idea is to control the spread and decrease exposure as much as you can.
For something a step further, I know this is in the smallpox family. If someone was vaccinated against smallpox when they were younger, is there any studies that show some correlation of protection here?
Yeah, so we do currently have vaccines that are available. We're utilizing them really in what we call a post-exposure prophylaxis situation. So these vaccines are here in the United States. They are available, but again, it's not something that we are recommending to the general public right now, you know, as kind of a pre-exposure method. Again, we're utilizing them in the post-exposure prophylaxis setting. And even with these vaccines, you know, we don't have, you know, the data that we would need to say, well, how are these vaccines going to fare in the current outbreak that we have? You know, similar to when, you know, COVID-19 emerged, although it was a novel virus, we were kind of gaining information and getting that information back out to the public. It's a similar story with the vaccines at this time. You know, this is more of a newer outbreak, not a new virus, but certainly a new territory for the virus. So we're gaining more information, particularly on, you know, the vaccines that we do have available that we know do cover the monkeypox virus.
I get this question a lot. The protection with early smallpox vaccine, which must have been decades ago, is really unknown. What CDC says that if you've had a vaccine 3 to 4 years ago and you've had an exposure with monkeypox, then you need to get revaccinated. But at this point of time, what protection does a smallpox vaccine decades ago provide is really not known. And the reason for that is because most of our data has come from Central and Western Africa, where we have seen these cases where it's endemic. So we really don't have lots of data around it.
And then just one more question. If someone is diagnosed with monkeypox or thinks they have it, in terms of treatment, is this something that most people will recover from on their own, or should they seek further medical attention?
Yeah, so absolutely. If you have concerns that you have been in contact with someone that has had monkeypox, even if you did not develop any symptoms, we're still asking you to please reach out to your healthcare professional, whether that's your primary care physician, whether it's your local Department of Health. And obviously, if you're developing any symptoms, which typically are going to be non-specific from the standpoint of a fever and kind of fatigue, and then you kind of get the specific symptoms with that pox-like rash. Absolutely, you're going to want to contact your primary care physician and healthcare providers because they are going to want to monitor you. Particularly, if you've been in contact and you don't even have symptoms, they're still going to want to monitor you for at least typically 21 days following that exposure.
Thank you. Is there any other advice or insight you'd like to share with people that we didn't talk about?
I think the most important thing at this point of time is that the general public and the healthcare workers should be aware of it and should catch this early as much as they can. The reason is that this is not a very transmissible as we have seen COVID has turned out to be, and you really need a prolonged contact with somebody, especially intimate contact or somebody who uses sleeps in the same bed as an active case to spread it. So if we are a bit vigilant, I think we should be able to control its spread.